Get iPhone 16 Pro in the Vodafone summer sale and save up to £708 when you trade in. Yours from £22.50 per month. Hurry, ends 10th of July. Go in-store or search Vodafone iPhone 16 Pro.
Send. Oh, I was my baby, you're from Calabos. The only boss. Wait, honest. Baby, I will be everywhere a day and everywhere they go. TAPTAP Send got me covered. If you need to send money or transfer money from Europe, from Canada, from USA, from UK, any part in Europe, you can send it through TAPTAP Send. And guess what? Oceania, they will receive it right here in Ghana and many countries across Africa. So what are you waiting for? Download TAPTAP Send now on Google Play Store or App Store. When you download, it's so easy to use. Tell your families, tell your loved ones to download TAPTAP Send. Okay? But also, when I receive my money, that's how the world is chilling. Like my view, hey, you crazy.
Download TAPTAP Send now on Google Play and App Store. TAPTAP Send, it's secure, convenient, easy, and fast.
After successfully redefining Accra's skyline with the delivery of the signature apartment, Cape May Properties presents an exclusive unveiling of the tallest residential building in Ghana, offering a first look of Sultan Sky. Sultan Sky, a magnificent representation of the seamless fusion of quality, groundbreaking innovation, and pioneering architectural brilliance. An extraordinary structure set to reshape the concept of upscale living, thanks to its inventive attributes and unparalleled commitment to precision. This master-planned residential development will focus on the building's location, security, privacy, the design's aesthetic brilliance, elevated features in each living space, cutting-edge smart home technology, and amenities beyond imagination, with fantastic residential features which include 24-hour concierge service, a state-of-the-art fitness center, a floating tennis court, a floating swimming pool, a spa, a sky pool, a sky lounge, a movie theater, co-working spaces, kids zone, distinctive lifts for staff and deliveries, private gardens, chef's kitchen, expansive terraces, entertainment rooms, restaurant, and 24-hour security. Sultan Sky, a new perspective in the sky.
So, Kodzo Asamany, put me to wrap to say. So, me send you my within a minute, in Sabakandra, and then one tap send.
Yeah, ebusiafo amanfo bidindi na nakoma kwachrewa 1 they recommended TAPTAP send amamo and that's for aba o send ko fa baby a da ye basa omo rating so ye omo ye A1 nti obia no do TAPTAP send na on say sika fa TAPTAP piao
yɛbɔ de wɔkyerɛ amansan yɛbɔ hu de wɔkyerɛ Ghana for say yɛwɔ akwantu ne adi sika kɔfie nie me yɛn fɛmfa baabi a yɛbɛnu yɛn ho TAPTAP sign TAPTAP edemu fua TAPTAP sign in this asu
TAPTAP de anyone na
TAPTAP de no na eko
media. So, I just heard myself twice. I think we're settled now. So, I'll start again. A wonderful welcome to everybody. And just some housekeeping. This show is brought to you by TAPTAP Send, so like, share. And today we are going to introduce I can't even call him a guest speaker anymore because he's literally a part of the show now. But our speaker for tonight, who is Dr. Kodzo, who is going to introduce the topic to us. So, Dr. Kodzo, how are you doing today? You're muted. Okay, Dr. Kodzo is having some technical issues. Please bear with us while he sorts himself out. But Dr. Kodzo today is going to talk to us about... Oh, there he is.
All right. Sorry about that.
Yep. How are you doing today?
I'm good. How are you doing, Abna?
I see. So you're wearing I'm fine, thanks. Weather's very lovely. I see you're wearing a Ghana shirt today. Maybe because we're Ghana in
Proud to be a Ghanaian every day.
Fantastic. That's a good answer. Okay, without further ado, Dr. Kodzo, take us through the question. The topic for the day.
Okay. Good evening, everyone. I'm glad that you guys are back here joining us today. Please do share the link, call someone to join us so that they can also learn something today. So I promised I was going to be taking medical conditions during pregnancy, and from time to time I'll just be picking them one by one. So today I decided to speak on should I say hypertensive disorders in pregnancy, also just or probably I'll just say gestational hypertension, and I fuse preeclampsia and eclampsia together because these are complications. Especially eclampsia is a complication that if it's not well treated, it can cause a whole lot of disaster, mortality to be precise. So I'll just dive into it. Let me see. Next week. Okay, cool. Okay, I don't think I'll be here for the next 2 weeks, but anytime that I come up, I'll probably bring something else. So I've grouped everything, all the topics, and I hope that I get the time to go through it all so that we can go through this whole pregnancy series like successfully. So anyway, so today I'm talking about hypertensive disorders in pregnancy and what you need to know. Since some of us are Ghanaians, I would want to bring this to your attention that the leading cause of maternal mortality in Ghana is hypertensive disorders in pregnancy. Talking about eclampsia and preeclampsia too. So hypertension, I think Dr. Akos has talked about hypertension some time ago, if I do remember. So we are not going to dive into what hypertension is, but I'll just touch on it briefly. I mean, if you know I know that a lot of people do. If you hear about BP, you know it's about your blood pressure. We are just talking about hypertension. So hypertension, BP, more than 140/90, measured on 2 different occasions, at least 4 hours apart. Just know that this is hypertension. When it comes to obs and gynae, this is what we normally do back in Ghana though. But every country has their own, how do I call it? It's not principle, there's a name that they call it for. So how do you classify hypertension in pregnancy? So we have the before and then we have the after. So before, if you have hypertension before you get pregnant, it's called chronic hypertension. We can say chronic hypertension you can get chronic hypertension with superimposed preeclampsia. I'm going to come to the preeclampsia and eclampsia, explain that. But just want you to know the clarification, the before and then the after. The after you've gotten pregnant, we have what we call the gestational hypertension. This is what you get when you are pregnant. The moment you get pregnant, you get hypertension. That is gestational hypertension. And you can have preeclampsia, you can have preeclampsia with severe features, and then you can have the eclampsia itself. So let me just give brief explanation for the before and then after, the ones that I've spoken about. So the chronic hypertension before, keep this in mind, hypertension before 20 weeks of gestation, a BP of 140/90, mostly, which is measured on 2 different occasions at least 4 hours apart, and it persists more than 6 weeks in postpartum period. So you start your hypertension, let's say you're a hypertensive patient, you get pregnant, and it's also persists like after you even deliver. I mean, it's something that is actually with you. Then the gestational hypertension, this is more like a new onset of hypertension with a BP of 140/90, measured in 2 different occasions, at least 4 hours apart, after 20 weeks. So here you've gotten pregnant after 20 weeks. If we do the measurement, if we go according to this rule that we use, then we know that you are this is gestational hypertension. But there are other lab values that we add to it, which is if you've never previously if you have never had, if you are not a hypertensive patient, and then we detect this, and there was no protein in your urine, because when you are pregnant, they ask you to we do test your urine. So if we test your urine and there was no protein in your urine before, but after this 20 weeks, if we get to find out that your BP recordings are 140/90, which is measured on 2 different occasions, it persists for 4 hours, and we get to find protein in your urine, and there are no severe features of preeclampsia. At least if we get to see, even with that, the gestational, you don't normally see some of these features, though. It just happened like that. So let's keep these value, what I've given you. Then we'll come to preeclampsia. So here you have the same reading, 140/90, measured on 2 different occasions, at least same 4 hours apart, after 20 weeks of gestation. Previously in what we call pneumotensive patient, that is someone who never had hypertension. But this time around, we have protein in your urine, which should resolve within some time. But then we have protein in your urine, and there is absence of some features that we look out for. Then we can say that this is preeclampsia. Now, these things, if are not controlled, if you don't control your gestational hypertension, if whoever is taking care of you, if your specialist is not taking care of you, or the people who are monitoring they are not taking care of you well, you can now tip into what we call the preeclampsia. Now, if they are not taking care of the preeclampsia, it can tip you to eclampsia, and that is the complication, and that is where the trouble starts from. There are some values that when you come to the hospital, we check the proteins, the signs that we are looking for. I'm going to mention the signs soon. So we have a chart that we use. So when you come, and then after 20 weeks, you have hypertension, the same value that I give, measured 4 hours apart, which persists for a long time, and then we get to find out that there's this is in the urine. We get to find out there's this what's it called? These features are showing up. Then it's something. It's more like it tip you into a high risk pregnancy where we need to pay attention because it can affect you and the baby itself. Now the eclampsia itself is where you can start having seizures. When you're pregnant, you can start having seizures, and eclampsia is more like diagnosis of exclusion. So what we do is that the moment we get to find out that your BPs are high, there's protein in the there's protein in the urine, you start having severe headache, blurred vision, and all these things. Then it calls for emergency. We need to do something about it. So I mentioned headache. So you start having this frontal headache, you have blurred vision, you start having difficulty in breathing. There is severe pain. Normally it is right upper quadrant, the epigastric region. When I say the epigastric region, the upper region of your tummy, that's probably where it'll make sense like that. In your urine, we can find proteins, or you can even produce little urine, which we call oliguria. So when these things come to play, we need to start treating it from the top. We need to try as much as possible to manage your hypertension where it starts from. The moment we get to find, I'm talking about gestational hypertension. The moment we see it, we have to pay attention to it. You really have to follow a strict protocol. The moment you decide not to listen to any of these things and you go and do other stuff, when we say rest, you rest. When we say you need enough rest, you don't have to overdo things. You don't have to stress yourself and then all of that. You really need to listen to all these advice that we are going to give you. Else, you can tip into preeclampsia. Now, preeclampsia now moves to eclampsia, which is the complication. And if you don't, if it is not detected early, you can tell. If a mother, you start having seizures, it can affect you personally, and the baby itself. You can lose the pregnancy. You, the mother, you can, if you let's say you even start having fit, and let's say you fall, you can probably even hit your head somewhere or something of that sort. Then it's going to cause like a whole lot. If we lose you and then we lose the babies, two different things. Most of the times when you come to obs and gynae, what we do is that we have a principle that we say that it's better you save if there is a life and death issue, and then we want to save one person, we try as much as possible to save both. But if we can't, we try as much as possible to save the mother, because we have this notion that it is possible that the mother can give birth again. So in all these things, we really need to pay attention to some of these signs, especially if you're a hypertensive patient and then you come to the hospital, or on your first visit, the moment you realize that you are pregnant, these are some of the things you need to let us know. Then we start taking it from there. What are some of the risk factors? Someone who has already, let's say if it's not your first time, and then I mentioned that women like repetition. So if you've ever had this condition before, or let's say if you've given birth and then you had gestational hypertension, and then it went, let's say after you got pregnant, we don't find your BPs going high anymore, whatever or whatsoever, it's possible that it can come back again. Some of the things that can actually happen is placental abruptio. It's something that I'm going to talk about later on. It's one of the topics. So this is where the placenta separates from the womb. It can lead to organ damage. There is a need for cesarean section. Is not a go-to process, but it can lead to cesarean section. So you can go under the knife. To the baby, it can cause restricted growth. The baby can be a preterm baby, there can be a low birth weight, and also the baby can die. So that's what we call stillbirth. Normally, you see some of these things in people under, let's say, under 20 years, or let's say 35 years, so extreme ages. Those who are way younger, and then those who are, way older. If you have family history of hypertension, you really have to pay attention to that, or family history, like I said, preeclampsia. If it has ever happened to you before, it has happened to anyone in your family, it's possible that it can also happen. It can also happen it can happen to people with multiple pregnancy, the twins. So the people who are always praying for twins, you're at risk of gestational hypertension and its complications. How are we going to diagnose this? Basically, we do regular BP checks at antenatal visit and at home. Sometimes it gets tiring. If you look at our mothers, they don't even like those, especially those who are the hypertensive ones. They don't even like checking their BPs because they feel that it's a waste of time. But truth to be told, the moment you get to that stage, it's supposed to be part of your lifestyle. My mother is a victim. I know she's watching. She doesn't like checking. When I wake up and I ask her, "What's your BP?" She will just mention any number, and then I'm like, this woman, she's even lying. Sometimes I have to sit there and I'll check it myself, and I realize that, she's actually lying. So, I mean, she's a hospital matron though, so you can even know she's very, very, when they get to that stage, they are very stubborn. And so as pregnant women, especially when the hormones are everywhere and then they are supposed to be checking from time to time, they can be like, and yeah, I remember my mother made a comment, say, what's it called? She said, I didn't know how to check that. Sorry, I'm getting a feedback. Anyway, I didn't know how to check here now. Check, and I'm like a whole hospital matron. Why would you be saying that? It's very tiring sometimes when you keep on checking and like try to you can't say what you show on side, and then you are checking here and then. And those who are also the diabetics too, every time you are just pricking yourself, it's very uncomfortable. But when it gets to this stage, what we ask you to do, that you have to be really checking like from time to time. We normally do urine tests to check out for proteinuria. We do monitor the baby's growth with ultrasound. So we need to see if the baby is actually growing well. We do blood tests for liver function. We check your platelets. We check your kidney functions, and then all of that. When it comes to this is gestation, this is just hypertension or gestational hypertension. When we suspect preeclampsia, what we normally do is we'll control. I'll talk about the management and the monitoring to how we're going to do it. So we control the blood pressure. There's some specific antihypertensive drugs that we use. There used to be a mnemonic for it, but I think new labs or something. All of them has like what it means, and like me, I don't talk about medications here before people go and buy medication and say that I'm the one who asks them to go and buy it, please. So we have some specific drugs that we use because it is safe during pregnancy. It's not all hypertensive that we give when you are pregnant, but those ones are safe. They are clinically proven that it is safe to use. So we do monitor the baby, and then we monitor the mother and the baby, and then at least so I'm using Ghana, we try as much as possible to deliver at 37 weeks. That's for mild preeclampsia. Then the monitoring, what we do is that we check your BP 4-hourly, we check your urine output. Like I said, you can have less urine, you can produce less urine. We have what we call the symptoms chart. Why are we looking for the symptoms chart? So that you don't tip into eclampsia. So we check for headache, blurred vision, and so on and so forth. We check your weight to see whether sometimes you get what we call edema. And then all that. So we check for these things. So we weigh and then see whether you are getting better or you are getting worse. If in less than 34 weeks of gestation, we give what's it called? We give steroid to help the baby's lungs to grow, because sometimes it prevents them. Is it that DEXA? Yeah. To help the baby's what's it called, lungs, because sometimes because of the delayed growth, some of the organs don't they don't develop like fast as it's supposed to be. And because we are targeting 37 weeks we have to make sure that we push or we do what we can so that everything will be fine. Else the baby might come and then the baby might be going through his or its own like complication. So we have, I don't know, there are, for the baby too, we do what we call the cardiac kick count. We try to see the number of times that the baby is kicking. Here, say, I mean, so a bit 29 years and then all. We have what we call biophysical profile. All these things are technical stuff that we do. When it comes to preeclampsia with severe features, that one we control the blood pressure. We try as much as possible to prevent the seizures. So we give what we call the max sulfate. Then we try and then plan to expedite delivery. So we try as much as possible to deliver the baby through the quickest route. So that's what we'll probably be looking at CS. So in these ones, we use stronger antihypertensives. And for the fits too, we don't just give it like that. There are different, we have a protocol that we follow to do that. Then, I mean, if you tip into eclampsia, that's the complication itself. That one, we are trying as much as possible to just deliver. There's nothing that we can do about that, but we just go straight and then just deliver. But when it comes to the chronic hypertension, if the patient comes and the patient is already on antihypertensive, what we do is that we review the drugs. That is, if you had it before you got pregnant, we review the drugs that you are on, because we say that, I mentioned that there are some antihypertensive that are safer during pregnancy. So we will take out those that are contraindicated during pregnancy, and then we'll give you the ones that we feel that will be safe for you. What can I talk about again? How can we prevent this? Guarantee There is no guarantee, no guaranteed prevention, but then the risk can be reduced. I mentioned when I was talking about when I started this whole pregnancy thing, I said the moment you find out that you are pregnant, go to the hospital. So early antenatal care is key. What's it called? There are some medication that we might probably give you. I don't want to mention it to high risk women. It's standard, something as per the guidelines. It's something that we do. I don't want to mention it. It's a very common drug that we use, else people might probably abuse it. How can And in everything, when it comes to pregnancy, I try as much as possible to fuse the partners or families into it, especially the men. How can you help, or how can you support your partners during these times, your wife during this time? Try as much as possible to encourage them to go for antenatal care. Back in Ghana, they don't want to go to the hospital, but they want to go to the market and go and then And then please, the men, that is not the time for you to push them and then say because if the person has, let's say, hypertension or gestational hypertension, and you have no idea, what I want to encourage, on call hospital, you do nothing, and then you have this mindset of and then all that. Their cases may be different, and one day and then you will never know. So what you can also do is to try as much as possible to monitor their medication that is being given to them and encourage rest. When it comes to the things that they said they should do, especially they should be checking their BPs regularly, you help them do it. If she's not in the mood until down nor any TV na say BBC no I catch so where this time you go and then do it for her. When it comes to the kid counts, you help them check some of these things, and then you encourage them so that they feel that they are not left alone. The last thing that I'll mention is a woman with hypertension will always, even during pregnancy, normal pregnancy, they are already tired. But a woman with hypertension will feel tired. They will be anxious. They will be worried because when they go to the hospital and they tell them what can happen if it's not treated, if they tell them about preeclampsia, mild or severe features or eclampsia and all of these things, every day when they are there, you realize that they might be panicking. There was a time that I think in VRA, I was at the hospital and the woman came, and then she came for review. She's a hypertension. She's not pregnant. She's not a pregnant woman though. She came. I just want to let you know how sometimes hypertension works. She came and then she wanted to review a drug. So what we normally do is that we check your BPs and then see whether you are taking your medications. Then we realized that the BPs were very high. We did everything that we could. We kept on giving the woman medication, and we'll check it 4 hours later and it wasn't going down. Then we had to engage her. I remember some of these things, it comes with experience. So we had to ask her, what is the problem? Apparently, she's thinking about something like, Sikasembi, Nejuma say, and then all of that. So whilst we are trying as much as possible to reduce it, will come down, it will shoot up again. Like she was actually thinking a lot, which was actually shooting up the BPs for it to go high. So as a pregnant woman, if they get to hear some of these things, they get scared. And then all that. So they will be thinking, they will be overthinking, and then it might probably just worsen everything. So this is a time where they need the emotional support, not just physical care. You can do everything physically, but try as much as possible to be there for them emotionally. The stational hypertension, or these things that I've spoken about, may not cause pain, but it might cause problems. Checking blood pressure in pregnancy, it's key. It's more like the oil in our car. It's very quiet, it's very simple, but it's life-saving if you normalize routine antenatal care and then watch these signs early. It's going to take you a long way, and then you have a fruitful journey during your pregnancy, especially if you have hypertension. I'll pause here so that we take questions. We promise to be closing early these days, so.
Yeah, thank you, Dr. Kodzo. Yes, we promised to close early. Thank you for the very thorough, as always, very thorough, if anything, talk through the topics. And as Dr. Kodzo promised, he will be going through a series of questions or health, should I say, issues related to pregnancy and whatnot. So every time he's around, you can expect that he'll be going through that. We'll be going through those kind of all your questions on that. So as usual, we will take a short commercial break, and then when we come back, we'll have our Q&A session, which is where you can ask Dr. Kodzo about gestational hypertension and preeclampsia. And or any other health topic that you have. I for one have a health question that I'm dying to ask. So we'll see you shortly after the break.
Me did the young antechua, and maybe I'm discovered for Europe. I come a bush for Ghana. No, me used to tap send. No fee mobile money transfer. Easy, convenient, fast, and sounds so free. Me discover map him tap send. NTN also download the TAPTAP send app. No, ever mobile phone so free. Na first ka come a bush for Ghana for na tap send. Papa no.
After successfully redefining Accra's skyline with the delivery of the signature apartment, Cape May Properties presents an exclusive unveiling of the tallest residential building in Ghana, offering a first look of Selton Sky. Selton Sky, a magnificent representation of the seamless fusion of quality, groundbreaking innovation, and pioneering architectural brilliance. An extraordinary structure set to reshape the concept of upscale living, thanks to its inventive attributes and unparalleled commitment to precision. This master-planned residential development will focus on the building's location, security, privacy, the design's aesthetic brilliance, elevated features in each living space, cutting-edge smart home technology, and amenities beyond imagination, with fantastic residential features which include 24-hour concierge service, a state-of-the-art fitness center, a floating tennis court, a floating swimming pool, a spa, a sky pool, a sky lounge, a movie theater, co-working spaces, kids zone, distinctive lifts for staff and deliveries, private gardens, chef's kitchen, expansive terraces, entertainment rooms, restaurant, and 24-hour security. Selton Sky, a new perspective in the sky.
So Kodzo Asamany, put me do rap to say. So me send ya my bush in a minute in Sabekandra, and then one tap send.
Yeah, ebusiafo amanfo me dindi na nakoma kwachirewa 1. They recommended TAPTAP send amamo. And that's for aba. O send ko fa baby a. Da ye basa. Omo rating so ye. Omo ye A1. Nti obian no do TAPTAP send. Na on say sika fa TAPTAP. Piao.
Yɛbɔ hu de wo kyerɛ amansan yɛbɔ hu de wo kyerɛ Ghana for say yɛwɔ akwantu ne adi sika kɔfie nie me yɛn fɛmfa baabi a yɛbɛnu yɛn ho TAPTAP sign TAPTAP edemu fua TAPTAP send in this asu
TAPTAP de enua na ye na eyi
TAPTAP de enua na ɛkɔ.
Hello and welcome back to the Health talk show. So Dr. Kodzo just talked to us about gestational. God, I've got a list. This is really difficult. Hypertension and preeclampsia. Dr. Kodzo, stop laughing at me. And he just took us through. That, and now we've got the Q&As. So again, just to reiterate, you can ask questions about today's topic or any other health issues or questions that you have. And Dr. Kodzo will be here to answer them as best as he can and refer you if he doesn't know. Dr. Akosia sends her greetings. She is on a night shift today. And today we'll try and close early as Dr. Kodzo is on an early morning shift tomorrow so that he can go and get some rest. So Dr. Kodzo, to start, since there are no hands up, as you can see, I've got my glasses on because all of a sudden I had a headache come on, which is affecting my left eye. And I don't know if you could tell if I was a bit uncomfortable during your chat. And this tends to happen to me sometimes, where it just randomly I get like my eyes, I get a headache which affects my eye, and then I kind of had like a sort of like a teary eye, watery eye, that's the word. So I'm just wondering what could potentially be the reason for these like headaches that then affects my eye. I tend to think it's like screen time, which is the reason why I've got my blue light glasses on. I'm getting too much screen time, so yeah, just wondering.
Okay. Anyway, so the headache affecting your left eye. This could be it could be different conditions. It could even be migraine. I don't know how it is, but migraine can actually radiate and affect like behind the eye. Like you could feel the pain like inside, like you feel that you probably want to put your hands in like at the behind your eye, and then you have a pain like that. It could be migraine. And normally women who are on their periods experience migraine headaches. So sometimes it could be due to this. It could also be cluster headache, which is when it's cluster headache, it's extremely painful. It is stubborn. It could be any of the eye, could be left or right, any of that. It could be sinusitis to sinus headache, where there's more like a pressure pain around it starts from your forehead, then it drops to your eyes, then sometimes you even feel some heaviness around your cheeks too. That's also there. So it could be different things. If you don't have any eye issues, I mean, I don't think you do.
Not that I know of.
Yeah, I don't.
Not that I know of.
Yeah, these ones are more like they are more severe ones where we have optic neuritis, temporal arthritis. All these things are quite deep. I don't think that's it. You need rest. Probably you need money in your bank account too.
That one is very true because the economy is not kind.
Yeah.
Anyway, I also just want to let our viewers on YouTube, I am monitoring the YouTube channel today. So if there are any questions on YouTube, you can ask and I will be able to see them and read them out for our doctor. Okay.
I'm just happy that there are no questions so that we can.
It seems so, but I have a wealth of questions for you, so don't worry about it at all. And so I will kick it off with, what is the difference between chronic hypertension and preeclampsia?
Okay. So when I started, I did this classification. Sorry. So chronic hypertension. Let's take it. My main kind of sheet. Before I be finding saying call hospital, yes, or hypertension. Into call hospital because all hypertension and also diabetes, also hypertension, and only I catch on and on or hypertension it drew so you go to the hospital, you get pregnant. The fact that you've gotten pregnant doesn't mean that the hypertension is missing. It is still there. It is with you. It's a condition that you have. Into no catch ANC for some more hypertension. What Fanin saying? What the hypertension? They Chanin saying hypertension that's where they and only chronic hypertension. And say about preeclampsia now, it starts from gestational hypertension. So gestational hypertension, this is what you get. Oh, yeah, na wunya hypertension. And that's sorry, ofa saying and wunya hypertension. Do you understand? So it wasn't as if say you had the hypertension before you got pregnant, but the moment you got pregnant, you now had the hypertension. Now, if it is not managed well, if your gestational hypertension is not managed well, so hypertension now when you're doing is not managed well, then you get preeclampsia. Then from preeclampsia, anything your friend preeclampsia is just basically in simple, like for people to understand the part where you start getting seizures in pregnancy. So that's what we want to prevent. So the preeclampsia, you can have like mild preeclampsia where ABR and shedding is serious, but the moment the severe features, when we talk about the severe features now, that is the headache that you start having. You start having blurred vision or nausea, tartar. Mind you, these things are common in pregnancy, but when it is beyond, like when unbearable threshold, then you should know, say you are tipping into it. So the difference between a normal chronic hypertension and a preeclampsia, you have to start from up and then come down. So before 20 weeks, you were already a hypertension patient, and then you got pregnant, and then you delivered. You are still hypertension. You are just known to be a hypertensive patient. Now the preeclampsia comes in when that is when you get you got the hypertension. To hypertension if you then it tip you into preeclampsia if it is not managed well. So,
right. Okay. And can preeclampsia happen without you having high blood pressure?
And
so you need to have high blood pressure before you can have preeclampsia.
Yes, you need to, because it's a standard. Your BPs should be 140, 90, like above those outrageous ranges for you to get to that. So if you don't have it, there's probably a different condition where you probably be having, but not preeclampsia, because all these things is under the umbrella of hypertension. So yeah.
Okay. And how does preeclampsia affect a woman's health after delivery, particularly?
After delivery, I mean,
or even before, or in general.
So, okay, how it affects before, we are scared of eclampsia, where you're going to have seizures, where the baby is going to be low weight, the things that I mentioned, where it could be preterm, where you could be tipped into CS, cesarean section, where we have to go in and catch you. It's not a bit more normal. Everyone prefers a normal delivery, to be told, but the moment you go under the knife, it has its own complications. What do I say? So we are trying as much as possible to prevent some of these things. So during birth, we are scared, and I say we are trying to prevent any mortality or preterm or something that is going to affect the mother. So that is the doing. After, if after 6 weeks, okay, I think I gave a definition there. After 6 weeks postpartum, we are trying as much as possible to see, say, it's gone, especially if you picked it from pregnancy. So mind you, chronic hypertension, it is possible, like it's likely, the chances are high, say the hypertension will continue still and so on, because you are known to be a hypertensive patient. But gestational hypertension, there's a possibility, say, after you've given birth, you are not going to have these symptoms, and I say your BPs will come down. So as to how it's going to affect it, later on, what we are praying for, and say hypertension is not there. But if it is there, you now become a hypertensive patient. So your pregnancy can actually give you hypertension, not just say you what's it called? You just got it from it and then that is it. So after it, you can now become a hypertensive patient through pregnancy. So for those who don't know, just keep it in mind.
Okay. It seems like today our audiences don't have any.
I'm so
It's
happy.
either said that you are happy. I think doctors, you've done a great job. This health talk show has really helped, and there's nothing anybody wants to ask, and that's great. But I have more. So, what lifestyle modifications can help, if I say, can help manage or prevent gestational hypertension and preeclampsia?
Okay, so first of all, I'm going to take it from chronic hypertension. If you are known to be chronic, someone who has hypertension, early A&T care, it's key. Where I'll say it again, the moment you realize that you are pregnant, don't worry, go to the hospital, start your A&T and let them take you through it. A normal bed check, your regular BP check is very key. There is not much guarantees that we can do to prevent it. But then, if you are chronic, we will have to manage you. But to prevent gestational hypertension is where we start monitoring your BP. So the moment we realize, say, your BP is going stroke akrana, some of the questions that we will ask and say, hypertension, will be a hypertensive woman, and say, when you be that, especially if it's not your first. If you are carrying twins, and also if you are carrying twins, you are at risk of like getting tipping into gestational hypertension. So A&T care, regular checkups, because the moment we see, say, your BPs are going high, and we start putting you on medications to bring it down, so that you don't even start it at all. It is normal for your BPs to go high when you get pregnant, but that doesn't mean, say, you have hypertension. So if you remember the definition that I gave now, 140/90 measured on 2 different occasions, 4 hours apart, which persists now. It persists for some time, and also for a long time, and then you're actually getting into hypertension, because the moment you carry a baby, you see a muye too. So it is likely, say, your blood will be going like a movie baby and then all of that, because the baby also needs supply. So it is normal for your blood pressure to go high, but that is not hypertension. So the moment you get pregnant and we are doing regular checks and we realize that we'll start managing you. We'll try as much as possible to drop what's it called, the blood pressure, so that it doesn't tip you into like real hypertension. But then so we do womb. Not say you are, I won't say you are destined to have it, but you will be. And I will answer anything they could down for my Ako school. You better try RSA. But truth to be told, like I mentioned, that what's it called? The statistics prove that is the leading cause of maternal mortality in Ghana. So we should be very, very careful, and then we shouldn't downplay it at all.
Oh wow,
Priscilla, don't do that to me.
That's good insight. I was going to do some research to see what if it is also the leading cause of maternal mortality here in the UK. But Priscilla, please, we'll take your question.
Hi, good evening. I just wanted to ask, so if somebody gets gestational hypertension and then they go into remission, right? Can they then get it again in different pregnancies or throughout all their pregnancies?
That's a very good question. Yes. So I always say this in obs and gynae, we say that women like repetition. So any medical condition that a woman has had before, she can have it again. It is possible that the woman can have it again. The moment she gives birth, let's say it is not there, she doesn't have any hypertension, the BPs are fine. The moment you get pregnant again, it is possible that you can get it again. So it's something that is there. Why are you saying A?
That's a bit too much.
I mean, Shama, and also like that's what
wow.
Women also bring on the table that men need to pay attention. Kudos to the men on the show today. You guys are, especially John. You are doing well. I don't know why. Maybe I don't know. Maybe I'll probably find out later. But you are doing well. It's good to have men to learn about some of these things, so they encourage their wives to to be doing something, because sometimes the ladies themselves they don't listen. They don't want to listen to some of these, and so it's good that the men also listen to. Into more about one family, no more. Say my girlfriend cry one family, is important. Anyway, Abna, do you have any other question? If not,
One last one. I was going to ask my final one before Priscilla, but just to add, hypertensive disorders of pregnancy, including gestational hypertension and preeclampsia, are leading causes of maternal mortality globally. So that means even in the UK too. So this is quite a pretty big topic, but I think it's very, very fair to say. I was gonna ask what support, just the final question, if there's no other questions to come. What support is available for women diagnosed with the gestational hypertension and preeclampsia? This is so bad for my lips. And also, if there's any healthcare professional in the UK, because Kojo is going to talk predominantly for Ghana. So if there's anyone in the UK who can sort of like either add to what Kojo has said for people in the UK, that would be great. If not, that's fine. We can take your experience of what you know. Kojo.
Am I supposed to say something?
Please, yes. I said you talk specifically for Ghana. I'm just saying
in Ghana, true to be told.
In general, but then if there's anybody in the UK, because your practice is mainly, you've practiced more like in Ghana more so. So if there's anyone in the UK also knows what kind of support is here for those of us in the UK, it would be great. But
I think Dr. Aklos would be the right person to ask, but I think in Ghana, we really don't have, truth to be told, we treat hypertension and diabetes as they almost say it's Kafoya area, but like that's how they've actually tagged it, but it's very serious, something that is actually the leading cause. I know people, hypertension itself, I know young people who actually died of hypertension, not even women, like guys. And it's something we really don't pay attention to. So the support is, so we are not allowed, they talk about it, but people, I want to say, nipa subain, our culture and everything, because to be honest, if we are going to really sit down and then really talk about hypertension, there are a lot of things that we really need to pay attention to, because look at the what's it called, area Ghana, and then your BPs are very high, like you are thinking headaches and then all of that. It's not even going to help you in the first place. Like Ghana, the kind of work that we do is not that flexible where you can probably sit at home and then say, so when the like you really need to be at work. And sometimes you are having these things, your BPs are high, and then you are working under stress and all of these things. I just know, some of these countries, the European countries and America and all of that, they don't joke with their mental health. The moment they say mental health, but Ghana, mental health is strength. Wouldn't mean for mental health any excuse. So some of these things we overlook them. So when it comes to support per se, we really don't have any kind of support. The only thing that we can do is encourage you to go to ANC, then we prescribe medication, because it's so sad that when you go to Ghana, sometimes the person that you're even going to meet at a consulting room is not like a medical doctor. They can probably, you can probably go and meet a physician assistant, and they are good. I trust in those people, especially if they have been under strict supervision. But what happens is that sometimes they just copy what their boss is doing. But I'm coming to reduce my drugs. You are supposed to actually check about buy and a drove now, so then they'll write it again and then they'll give it to them. So imagine when it comes to pregnant women, what happens? They also don't really pay attention to that like that. So we really don't have any support like that. Just the emotional support is very important, and they should be pumped. Yeah.
Okay, great. Well, since there isn't any hands up or anything, I'm not a doctor, obviously, or a healthcare professional, but I did some Google research on the sort of support that is available here in the UK for women diagnosed with gestational hypertension and preeclampsia. So there are organizations like Action on Preeclampsia who provide information, support, and confidential helplines, NHS website, and the National Childbirth Trust offer information and support on for pregnant women. And obviously, if you are diagnosed with the specialized care, which is provided through the hospitals and the maternity units, with access to services like patient advice and liaison services. So there is support out there for those of us in the UK. If any, and obviously I stand corrected as well, because like I said, it's just a Google search because I am not a healthcare professional. And Dr. Akos or any of the doctors can always clear it for us if you have further information or further questions. Well, it seems like either the topic was really specialized and nobody has some kind of experiences or any questions on it, and this was just more informational and taking in information, which is great. And thank you, Priscilla, our sole question person. Thank you for your question, and thank you to everyone that was here. Dr. Kodzo that is here and has been a part of this show. Dr. Kodzo, any closing remarks?
The only thing that I'll say is that when you are pregnant and you are known to have hypertension, or you are being told that you are a hypertensive patient, or you have gestational hypertension, and then you start having headaches, frontal headaches, blurred vision, difficulty in breathing, you have severe right upper quadrant pain or epigastric, like at the below your chest, like your tummy, that part, and you are producing less urine than you should, please just run to the hospital. These are the severe features. It is good to know these things. It's one thing to know that you are a hypertensive patient whilst you are pregnant, and it's another thing for you to know some of these severe features. You might mistake it as a pregnancy symptom, that it is normal, but it is not. But the moment you see some of these things, please rush to the hospital. And the moment you get pregnant, please rush to the hospital and start your A&T. It's very important. Our next topic will probably be diabetes in pregnant women. Now on to I hold the questions.
Okay, Dr. Kodzo, thank you. So you had here our next topic, and that doesn't mean next week. It will be when next Dr. Kodzo is in. He will be covering diabetes in pregnancy. So yes, as I mentioned earlier, just in case you missed it, Dr. Kodzo last week told us that he will be doing a series on pregnancy, so from start to finish. He took us through the stages of pregnancy, and he's taken us through sort of the health issues you could potentially sort of meet with pregnancy, and how to prevent it, or how to deal with it, or how treatment and those sort of things. So please do join us each and every Wednesday to be informed on these health topics and other health topics which other doctors like Dr. Akos, Dr. Mustafa will be covering through and through on every Wednesday right here. And on Thursdays, which is tomorrow, we've got a time of TAPTAP Send. That's at 8 p.m. same time. And then on Friday, we've got Ask the Lawyer. So join for your immigration questions, as the law and the law on immigration, it keeps changing day in, day out. And also, if you've got any other questions, any topics health topics you'd like us to cover, please join the OT WhatsApp community, where you can get updates and on what's going on with the shows, and also follow us on our social medias, and just let us know if you've got further questions or anything you would like us to cover, or anything you'd like us to discuss. So without further ado, I will wish everybody a good night. Once again, thank you for joining us, and see you all same time next week.
TAPTAP send. Oh, I was you're from Calabos, the only boss. Wait, one is baby, I will be everywhere a day, and everywhere they go. TAPTAP send got me covered. If you need to send money or transfer money from Europe, from Canada, from USA, from UK, any part in Europe, you can send it through TAPTAP Send. And guess what? Oceania, they will receive it right here in Ghana and many countries across Africa. So what are you waiting for? Download TAPTAP Send now on Google Play Store or App Store. When you download, it's so easy to use. Tell your families, tell your loved ones to download TAPTAP Send. Okay? But also, when I receive my money, the other tell the world with channel, like my view, you know, hey, you crazy.
Download TAPTAP Send now on Google Play and App Store. TAPTAP Send, it's secure, convenient, easy, and fast.